But thank you for joining the SFY2026 SUPTRS Block Grantee survey training. And hopefully today we can kind of cover the program participant surveys for this coming year and give some updates on the status of program participant surveys and guidance on implementation and whatnot. So today we'll be talking, we'll be starting off with some introductions. Then we'll be going into a survey overview, talking about what the surveys are, who uses them, why we use them, providing some SFY 2026 survey updates, and updating on the survey types and their formats. And then we'll be diving into the survey instructions, how to access them, how to administer them, obtaining parental consent, and then tips and tricks to make sure that you're able to administer the surveys successfully so that you're able to get back data to provide your organization with some evaluation. And then we'll end with some survey discussion for grantees to talk about their survey implementation processes and an opportunity for Q&A. So we'll start off with some introductions. My name is Jessie Dexter with the Office of Drug Policy. I think you guys all know who I am. And then I'll also have Grace Tucker introduce herself, if you don't mind, Grace. Sorry.
Yeah. Hi, guys. My name is Grace Tucker, and I'm the research analyst for ODP.
Grace helps with our kind of like survey management and data gathering processes. And then I'll kick it over to the Tri-West group. This is ODP's evaluation services contractor.
Hi, everyone. Good morning. It's very nice to meet you. My name is Lee Fisher, and I'm an evaluator with a small organization called the Tri-West Group. Tri-West is actually based in Boulder, Colorado, but we live and work throughout the country. We're very excited to be working with Jessie and Grace and their team at ODP to lead the statewide evaluation of their prevention efforts. We are preventionists at heart and really care deeply about this work and look forward to getting to know all of you and your programs and various approaches. I'm joined by Cassie Morgan and Brittany Betry-Watson. So we comprise the evaluation team, and we're here to answer questions throughout the year, as if you're wondering about the evaluation or if you have any feedback, we're open to that. We can provide assistance as needed. So just feel free to reach out anytime. We really appreciate the input you all provided to us earlier this summer when we sent out a survey asking for feedback about the evaluation. And we used that feedback that you all provided to develop a statewide evaluation plan. So our goal is to look at all of the prevention funding going to ODP and then out into communities around Idaho and identify common indicators, common outcome measures across all the various types of prevention approaches being implemented in the state. And then to bring that together to discuss in a statewide evaluation report. So that is what we are working on now. We're working on the FY25 report. And then next year, we'll use the surveys that we're going to share today and other data that we're capturing to write the FY26 report. So I think, any support you can provide to the evaluation, your time, the data that you send us, the survey results is extremely helpful because it helps us support ODP in looking at outcomes, looking at the impact of prevention services in the state and funding, and hopefully make the case for further scaling and sustaining prevention in Idaho. So again, thank you for the work that you do to support our work as evaluators. I wanted to mention that the surveys that you're going to see today look different than last year and previous surveys, and we'll talk more about that in a bit. But what we tried to do is align the surveys with key evaluation domains. And so for our evaluation statewide, we want to look at implementation of evidence-based programs and practices. We want to look in particular at fidelity and quality of implementation. And we'll be looking at the quarterly activity reports you all fill out in order to help inform that part of the evaluation. We also want to look at reach. How many children, youth, parents, caregivers are being reached through prevention messages, through prevention programs, through coalitions. So we want to capture number of people reached or served. We also want to understand the various types of collaboration that are happening around the state. So how you all as grantees are collaborating with other systems or providers or entities within your communities. And then we'll be looking at key outcomes. So substance use prevention outcomes. And so those outcomes is what we're hoping to capture with these surveys that you'll see today. And then the final domain that we're evaluating is infrastructure and sustainability. So really thinking about how to build, what the current infrastructure for prevention looks like in Idaho, and how to build it and sustain it further. So again, thank you. It's great to meet you all, and I'll pass it back to Jessie.
Awesome. Thank you, Lee. Appreciate that. And we'll be able to dive into the surveys a little bit more as we go through the training, but I appreciate that overview. Okay, so next we're going to dive into survey overview, who uses them. So grantees that received SUPTRS block grant primary prevention funds to provide direct service evidence-based curriculums, prevention education for programs such as BOFIN life skills, positive action, strengthening families, nurturing parents. All of those are required to conduct surveys with program participants at the completion of each program cohort. Hopefully that's clear. And why do we use them? Lee talked about this a little bit, but these surveys have an immense value for both ODP and hopefully for our grantees as well. For ODP, the surveys are used to inform our agency's overall annual state level grant program evaluation. It helps our office understand which programs are being impactful with different groups and different populations in different settings. And it helps ODP demonstrate the positive impact of our primary prevention grant funds to the state legislature. Sorry, let me scroll down a little bit. Every year, our office does an annual state level grant program evaluation for all of our grant funded activities. And this helps us identify and kind of guide our funding decisions, see how things are going, what's being successful. We do also every year have to go in front of the state legislature and ask for spending authority to spend federal grant funds. So it's very important for us to be able to explain to them that these funds are making a positive impact and we're getting a bang for our buck, which the legislature has asked us that in the past of how do we know we're getting a bang for our buck with these federal funds. And because of these surveys that we've been implementing and our grantees have been implementing with program participants for many years, we were able to do a cost-benefit analysis in 2021. And the findings from that showed that for every $1 of funds invested in substance use prevention, we gained a benefit of $20.63, which was an awesome outcome. And it clearly demonstrates that the work of prevention providers and our grantees implementing comprehensive, multifaceted prevention strategies are being very effective and are utilizing public funds very effectively to reduce substance use and prevent substance misuse across the spectrum. And these surveys hopefully also provide great value to grantees. After the program year, the end of the program year, eligible providers will receive a summary outcome report of their program survey results. Both the state level and provider level reports will help grantees understand the impact and value of the different evidence-based programs, and the outcome data can help grantees demonstrate their impact and be used to help guide and strengthen their applications for future grant cycles, as well as help guide your guys's planned prevention activities in future years. It can help you understand what programs have been effective. If you're doing more than one program, or if you've been doing one program for multiple years, understanding how successful it's been, if you guys should pivot moving forward, maybe try a different program, or try to make adaptations or whatnot, and hopefully give you guys some valuable feedback of how effective this past year has been and how to plan for future years. And also, it's really great data to have in your guys' pocket when if you request or apply for funds from our office in future years, or if you're seeking outside funding from other entities. Being able to have data to show the impact of your work is really beneficial to have when you're trying to request funding in any sort of capacity. So yeah, it helps grantees understand, demonstrate the impact of their programs. Outcomes can be used to guide and or strengthen organizations' applications in future years, and the data can be used to support efforts to receive grant funds from other sources. And when I say eligible grant recipients or eligible grantees, I'm referring to grantees that are able to administer, collect, and return enough participant surveys for ODP and TriWest to do provider level evaluation. We'll get to that in a little bit. Awesome. So survey overview, the survey types and formats. Did my screen? Okay, perfect. So what's staying the same? Last year in SFY 2025, our surveys experienced somewhat of a significant change. So prior to SFY 2025, ODP had 3 survey tools. We had a younger youth survey tool that was used for youth in grades 4 through 5. Then we had an older youth survey tool for grades 6 through 12. And then we had a parent survey. And the youth surveys, the younger youth and the older youth surveys, they were in a pre and a post format. So they were administered twice, once at the very beginning of the curriculum and once at the very end. Last year in SFY 2025, we shifted and we dropped the younger youth survey. So youth in grades 4 through 5th were no longer being surveyed. And we changed the older youth survey for youth in grades 6 through 12. We changed it from a pre-post format to a retrospective format. So that survey only had to be administered with program participants one time at the very end of the cohort, at the very end of the program. And we did that for a couple of reasons. One, to help ease the burden of survey implementation, hopefully making it easier to administer them if you only had to do it once rather than twice. And also, the outcomes from the younger youth survey were often not, it wasn't providing a significant value to grantees. A lot of times that younger youth survey, if you're surveying or doing programming with youth in grades 4 or 5, those youth often aren't using substances and don't have a positive view of substances at the beginning of those programs. And so at the end of their program, they still are using substances and they still don't have a positive view. So often those surveys would show kind of no change, which in many ways is a good thing. But it was just not providing, I guess, enough of a value to, keep pushing grantees to utilize a younger youth survey as the dynamics in Idaho were changing and surveying youth was becoming a lot more complicated. So we shifted in SFY 2025 to try to make the survey implementation process easier for grantees while we navigate kind of the changing dynamics in the state around surveying. So we also shifted a bit in SFY 2026. So this year, grantees will you will utilize 2 survey tools with 2 participant groups. So there is an older youth survey for youth in grades 6 through 12, and then there is a parent survey. Both the older youth and the parent surveys are in retrospective format. So this is the same as last year, SFY 2025. And that means that you only administer the survey once with participants at the very end of the program. What's changing this year? So the survey questions, as Lee mentioned, at the end of last year, TriWest did a survey with block grant grantees to gather feedback. And that feedback has been integrated into this whole evaluation process. The survey tools themselves were updated. Those survey tools have been the same for, I want to say, at least the past 5 years. They were created with our past evaluation services contractor and our previous optical survey scanning contractor But some of the feedback that we received is that when we converted the older youth survey into a retrospective format, it was challenging to follow. Youth were having a hard time understanding how to respond. It wasn't very clear. So we did review the survey questions, and the TriWest team, really tried to parse down the questions, focus on what do we need to ask, how can we improve this for validity and clarity, and then reformat it in a way to make it easier for program participants to use and easier for our grantees to administer. So the questions have been updated, and then also that visual format of the surveys to improve that clarity for respondents. The surveys are still formatted to be 1 page front and back. So that's just like in all past years, the surveys have technically been 2 pages, but we have always really pushed grantees. They should be utilized by being printed and done as 1 page front and back. Okay, survey overview, the survey types and formats. As I mentioned, this year there are 2 types of surveys. There's the older youth, grade 6 through 12 survey, retrospective format, and then there's a parent survey. And the parent survey has historically always been in retrospective format, so that's not a change, but the formatting of that did change. And younger youth in grades 5th and below are not being surveyed. Our office has never surveyed younger youth in grades 3 and under, but now we no longer require grantees to survey youth in grades 5 and under. So we just have these 2 types of surveys, and then we offer them in 2 survey formats: paper-based, which is the image of the paper-based surveys are up on the screen, and then we also offer online computer-based surveys as well. And we automatically, the TriWest team is automatically creating paper-based surveys for all of our grantees and their grant programs. So there are separate surveys for every grantee and every grantee program, if a grantee is implementing more than one evidence-based direct service curriculum. And they are automatically creating those paper-based surveys, and then we will create the computer-based surveys upon request, and we will show you how to request those computer-based surveys in a little bit. Let me make sure I didn't miss anything. And also just want to add, we historically have also offered our parent survey in English and Spanish. We have offered the youth surveys in Spanish in the past, but historically only the Spanish parent survey has really been utilized, but TriWest does have a Spanish translated version of the youth survey this year as well. So we can have that available to grantees if needed. Okay. And sorry, I'm just looking at my notes here. Regarding the paper-based surveys, these surveys will be printed off or printed and then copied by grantees. ODP will reimburse grantees for the printing and copying costs for the paper-based surveys. Each survey for the younger youth and the parent are 1 page, double-sided. And then the online surveys can be shared with program participants via a link to be completed online. This was something that we began offering during COVID-19, and it's been continued to be used by some grantees that offer virtual programs or just find it easier to have the surveys completed electronically rather than printing them off and doing the paper-based implementation. And we also have a survey administration implementation guide and instructions that we will share with everyone, and it will take you through the steps of how to implement both the paper-based and the computer-based surveys. Okay, survey instructions, how to access them. So the paper-based surveys, these will be shared via email with all grantees directly. So you'll be getting an email with your paper-based surveys as well as a copy of the program survey administration instructions. And then I will also be uploading a copy of your surveys to your grantee portal in Neighborly. So in Neighborly, when you log in, then you open your grantee portal. On the left-hand navigation menu, there's a Documents tab. In that Documents section, I always upload a copy of your completed grant agreement, and then I will also upload copies of your survey documents. So you will receive them in a couple of ways. Again, you'll get them via email, and then they'll also be uploaded into your grantee portal in Neighborly. And then for online computer-based surveys, these are provided upon request. So you will complete an online JOT form to request computer-based surveys. The link is there on this slide, and then we will also be sharing it out in the follow-up email from after this meeting. And then the link is also provided in those survey administration instructions as well. So you can request those, and then we will work with TriWest to get that to you, hopefully within like 1 to 2 weeks. Yeah. And then survey administration instructions. The survey administration instructions, example surveys, parental consent information, and other resources can be found at that SUPTRS Block Grant Provider Information webpage. This is a webpage that we've referenced a lot in the online or in the grantee onboarding webinars and other trainings. It's on our prevention.odp.idaho.gov website, and I will be sure to share the link to this page in the follow-up email as well. Okay, I think that is everything on that slide. Okay, so who do you survey? Per the SFY2026 block grant agreements, grantees that are providing direct service evidence-based prevention education curriculums are required to conduct program surveys with participants. So grantees should survey all older youth participants in grades 6 through 12 and all parent participants that receive direct service evidence-based curriculum programming when possible. And that does mean that with parents, you do not need to try to obtain any kind of consent to survey parent participants, but you do need to receive parental consent to survey youth participants. We will dive into that in the next slide, but you are required to survey all of those older youth participants that you are able to receive parental consent to survey. So we understand there are challenges in kind of the climate and dynamics across Idaho, that it's not always easy to get parental consent, especially in school-based programs. And there's a lot of challenges around surveying in schools. So if you are having challenges, with an anxiety around receiving parental consent, or if your partners or potentially school-based partners that we're going to be running with programs, if they are unable to move forward with any parental consent processes, or trying to move forward with a survey puts your ability to implement the whole program at risk, feel free to reach out and we will try to work with you. We understand that it's not as easy as it sounds to get all of that completed. So just let us know and we will work with you to navigate that process. And then participants in grades 5 and under should not be surveyed. There's not a survey tool for those participants, and you should not survey any participants in grades 5 and below. Okay. Obtaining parental consent. Sorry, I just remembered something. I'm gonna go back. I just want to go back to survey overview. One thing I forgot to emphasize here is if you utilize surveys in SFY 2025, you'll notice that, and like I said, the formatting of this has been updated. The surveys are different this year. The questions are different. The formatting is different. It's extremely important for grantees to use the SFY 2026 surveys. Every year, we have inevitably a veteran grantee that utilizes a survey from a past year. Those surveys, it wasn't, in past years, it maybe wasn't as big of an issue. Last year, that was a challenge because if you used SFY 2024 surveys, the pre-post survey, instead of the retrospective survey, it's getting more and more complicated. If you use a past year survey like SFY 2025 or prior survey this year instead of your SFY 2026 surveys, we won't be able to utilize that data. The questions are different. The whole survey structure is different. That data is going to unfortunately kind of just have to get tossed. We won't be able to utilize it. So for both the parent and the youth survey, it's extremely important that you use the 2026 survey data or survey files. If you don't, we won't be able to use that data for the state level evaluation, and we also won't be able to use it to provide any provider level outcome evaluation. So please make sure to use the SFY 2026 survey files. Just wanted to clarify that. Oh, and I also forgot, sorry, TriWest. Was this the point, Cassie, where it would be helpful to let you share your screen and we could go through the surveys?
Sure, yeah, we can do that. Let me get those pulled up here. So, hi, everyone. As Lee and Jesse have mentioned, we have revised these surveys to align with our evaluation plan and to capture information based on anticipated outcomes of your programming. Jesse was just stressing the importance of using the SFY 2026 surveys this year. So you'll notice on these surveys, the new ones, the ones that you should be using have SFY 2026 up in the upper left-hand corner. But for both, I was also just going to mention that Jesse has referred to the survey questions or the surveys being retrospective. And that means for both of the surveys, the older youth and the parent survey, participants are going to be marking how they think they would have answered questions before the program and how they would answer questions after completing the program. So you can see here on this youth survey, we have a column here for participants to mark their responses before the program and then responses for after the program. For the youth survey, which is shown here, which again is for young people in grade 6 and up, the first section, section A, has true false items to assess substance use knowledge before and after participating in the program. For example, drinking alcohol can slow down your thinking and reaction time. Marijuana or cannabis use can affect your memory and ability to learn. And again, they would read through this statement and mark how they would have answered before the program and how they would answer now after participating in the program. The next section here, section B, assesses resistance skills. And beginning with this section, we switched to using a Likert scale with responses ranging from strongly disagree to strongly agree. For example, I would say no if someone offered me alcohol. I would leave a situation where people were using drugs or alcohol. And just going to the next page here, section C has questions to assess attitudes towards substance use as well as some protective factors. Examples of that are it's okay for someone my age to drink alcohol occasionally. My parents or caregivers and I talk openly about important things in my life. And then finally in the youth survey in section D, we ask about substance use. So for this one, we're shifting the responses to asking about how often they would have used a substance before participating in the program, and then now after participating in the program, the frequency. And those responses range from never to daily. For this one in particular, we tried to limit the number of questions we're asking. We've tested these out, but we'd love to hear from you if you're finding that young people are consistently struggling with understanding certain items. That will help us refine the survey for future grantees and in future years. I'll switch to the parent survey here. For the parent survey, there are also 4 separate sections set up in the same type of way. They're answering each question, thinking about how they would respond before the program and how they would respond now that they've participated in the program. The first section has items pertaining to communication and family expectations. I'm not sure how small this is for you all, but for example, the first statement is, I have clear and specific rules about alcohol, tobacco, and other drug use in my family. There's a question, or there's an item, my child and I communicate openly and honestly. My family resolves conflicts in a healthy way. So those are some examples for that section. And moving on to the back side here, section B asks about parenting skills and knowledge. So the first one is, I avoid yelling, blaming, and physical punishment with my child. I praise my child for healthy decisions and good behavior. I recognize warning signs that my child might be using substances. So those are some examples from that section. Section C has items related to family cohesion, bonding, and parental involvement. I feel emotionally connected to my child. Our family spends quality time together on a regular basis. We have established routines that help us stay organized. And then finally, the last section, section D, assesses parental confidence and support. I feel confident in my ability to be a good parent. I have effective ways to manage stress related to parenting. I have family, friends, or community resources I can turn to for support. So that's just kind of a quick overview of both of the surveys and the types of questions that we're asking of your program participants. And I think we'll have a chance for questions here at the end, but with that, I'm going to turn it back over to you, Jesse.
Awesome. Thank you, Cassie. Okay, so you should all be seeing my screen again. Great, so hopefully that was helpful. And you guys noticed that when Cassie was going through that, and then on the images of the surveys, updated surveys on the screen, up in the upper left-hand corner, it says, it identifies the youth survey and the year. And then it will also say, right now this template, it says region, grantee, program. Up here in that header, it'll say the survey type, youth or parent, the year, and then it'll say your region, your organization name, and then this specific program. So make sure to, when you're implementing the surveys, to double check that header. If you're receiving funds to implement more than one evidence-based curriculum and you're receiving, so you will get more than one survey, because the way we use these surveys, it's per grantee program. So if you're doing, say, positive action and like BOTFIN life skills training, you will get 2 surveys, and you should pay attention to the header. They will be titled, differently. We will make sure to include the title, like the program, in the survey when we, name it, name the file. But up here in the header, it'll say your organization and it'll say the program. So just make sure to be aware of that and keep an eye on that so that you're using the correct survey in regard to the correct survey year, the correct survey format, and the correct survey for each individual program. Okay. And another note just on these program survey administration instructions, these will, again, it's a PDF. It'll be shared out with you guys in the follow-up email. It also will be housed on that SUPTRS Block Grant Provider webpage on the prevention.odp.idaho.gov website. But within the program survey administration instructions, there's very detailed guidance on how to implement the paper-based and the computer-based, and we also provide scripts for grantees, program facilitators, for when you administer the surveys. There's a script to help support your facilitators to kind of read off during survey implementation. So great resource. Okay, obtaining parental consent. So to survey youth in grades 6 through 12, you do need to obtain parental consent. It's important to note and differentiate that you do not need to obtain parental consent for youth to participate in the program. You just need to obtain parental consent for youth to complete the survey. So parental consent must be obtained before the implementation of the youth surveys. Grantees administering youth surveys to ODP grant-funded program participants have the option of using passive parental consent or active parental consent. Sorry, I just want to make sure I get this right. And the type of parental consent you use is dependent on the preferences of the stakeholders involved. Parental consent around surveys has gotten a bit more complicated the last couple of years. There was legislation passed in January 2023 around the use of active and passive parental consent in schools, in school-based settings. Historically, schools and school districts have had the ability to choose whether they wanted to utilize active or passive parental consent. The legislation in 2023 made it a bit more complicated and is encouraging schools and school-based programs to move more towards utilizing active parental consent and away from using passive parental consent. But that, at least from my understanding, is just for school-based settings. So if you are doing programming outside of schools and outside of school-based settings, then that legislation doesn't apply to your programming in the same way, but you are still required to receive parental consent, whether it be active or passive. But grantees have the ability to work with their stakeholders and work with their program to choose which format or which method of parental consent they would like to use. Under passive parental consent procedures, parents and guardians inform the program facilitator only if they do not want their child to participate in the survey process. So that's where every student is every program participant is automatically going to be surveyed, and then parents are asked if they would like to opt out of it. So if they do not opt out, if they don't submit any opt-out documentation or respond to opt-out, then program youth will be surveyed. Under active parental consent procedures, parents and guardians are asked to inform the program or inform the grantee or the organization, the program facilitator, only if they do want their child to participate, or that's opt-in. So under active parental consent, no students will be surveyed unless their parents or guardians opt into the survey process. So historically, grantees have kind of more leaned towards the passive parental consent procedures. It's a bit easier. It's challenging to get parents to submit submit documentation. Active parental consent does tend to lead to fewer surveys being completed. But that's just the difference. Passive consent is opt out and active consent is to opt in. But grantees have the ability to choose active or passive parental consent depending on what works best for your organization and the setting that you're in. Providers or grantees and facilitators are responsible for keeping a list of youth whose parents have declined their participation in the survey. And it's grantees' responsibilities to be sure to only administer the survey to youth whose parents have granted permission or have not declined their child's participation in the survey. So grantees are responsible for doing the parental consent process and then responsible for maintaining records of the students that can and cannot be surveyed and administering those surveys appropriately. Again, just want to emphasize, students can still participate in the programming even if their parents decline consent for them to be surveyed. They can still participate in the programming, just not the survey, unless otherwise specified by the parents. So there is occasionally parents who don't want their students to participate in any of it. And so if the parents do go to that step to specify that they don't want their child to participate in any of the programming or the survey, then our grantees have worked with that on a case-by-case basis. If that's working with a school to find an alternative activity for the youth to do during the times of the programming or whatnot. But if you are struggling with that, where you have a large number of parents that come back and say, hey, you don't only have consent, you don't have my consent to survey my child, but you also don't have consent to even have them involved in this program, you can feel free to reach out and we can try to provide support to navigate that process. But that hasn't historically been a significantly big issue in the past, at least that I'm aware of. Before implementing youth surveys, providers or grantees should review the parental consent policy on Idaho's substance abuse prevention programs serving minors. This is located on the SUPTRS Block Grant Provider Information webpage on ODP's prevention website, and we will also make sure to share the link. The link is on this slide, and we also will make sure to share it out with you guys in the follow-up email. And more information, including the parental consent policy, sample survey forms, and fillable PDF parental consent denial forms can be found on the ODP prevention website as well. And again, like I said, that link will be shared out in the follow-up email after this training. Any questions about parental consent before we move on? Cool. So submitting completed surveys to ODP. Grantees will submit the completed paper-based surveys to ODP by mail. Grantees can send surveys to ODP at any point in time. You don't need to wait until you have a certain amount collected or until all of your programming is completed. If you're doing multiple cohorts, you will administer the survey with those cohort program participants at the end of each cohort. So if you're doing multiple cohorts and you finish one cohort, you can go ahead and send those surveys to us. If you'd rather hold on and store them and then wait until you finish another cohort and then add all the surveys together and then send them to us in one big blob, you're more than welcome to, but you can submit them to us at any point in time. You don't have to wait till the end of the year or the end of the quarter. You can go ahead and just send those in to us. And when you do send those to ODP, just be sure to keep any of your receipts for any shipping or mailing costs, and we will reimburse grantees for the cost of both printing these paper-based surveys and then also shipping them to our office.
Say, Jesse, can I ask a quick question?
Yeah, go for it, Joey.
Yeah, so we have language around the parental active and passive consent for our annual surveys that we do. And I'm wondering, do you have sort of a template for that just kind of gets in ODP language, how that's best framed to a parent? That would be helpful to us, because I just don't want to misspeak when I'm adapting language that's geared towards a different survey instrument, and have that somehow come back against us.
Yeah. Yeah, absolutely. ODP has, we have like parental consent template forms and kind of guidance on that on our website, and I can share that with you. So that could be helpful. And you can look at that and you can adapt it if you guys already have language that you use. You can, look at some of the templates we provided and merge it, or, whatever you guys feel comfortable with. But we have resources to help you with that language. Cool. Awesome. And yeah, I'll share the links out with that, Joey, after in that follow-up email. So we'll get that to you. Cool. Once the paper-based surveys are submitted to our office, ODP counts them, and then we send them on to TriWest, our evaluation services contractor. They will be the ones scanning the surveys and processing that data, and then the surveys are all disposed of in a way that kind of protects the confidentiality and ensures that those materials, we get the data out of them and then we securely dispose of them through shredding. When grantees use online surveys, the program participants will submit their survey responses online. So grantees do not need to print them off and mail them as paper surveys. We've had grantees do that before where I think with online surveys, if it is easier for your program or your organization to implement the survey through computer-based format, that's awesome. We will definitely provide that survey, that electronic computer-based survey to you. But please be sure to request a computer-based survey from us, and then TriWest will create and generate a computer-based survey specific for your organization and your program, and then we will share that link out with you. In the past, we have had grantees take a paper-based survey and then build out their own computer-based survey, or try to put it onto like a Google form or whatnot on their own, and that gets really it just gets messier, and we're not able to really pull that data, and we don't want to waste your time or your program participants' time. So just make sure to request a computer-based survey from us and use the computer-based survey that we generate for you, and then know that you are not responsible, because we've also had grantees create their own computer-based survey and then print off the responses and then send those to us. You also don't have to do that. When these computer-based surveys are submitted by program participants, that data automatically is being collected by TriWest. So you don't need to worry about printing anything off or mailing us anything related to the computer-based surveys. But when you do mail the paper-based surveys, the mailing address is there on screen. Our office, I just had the realization, our office will be moving a physical location come the end of October. So I will make sure to get the updated mailing address for you guys and share that out with you all and keep you all updated on that, because our mailing address will be changing in the next couple of months. So we'll keep you updated on that, though I assume if you guys, even if you actually mail stuff to our old address, I think the state will be able to find us. Okay. To receive an evaluation report from ODP, providers must submit surveys. In the past, providers have, and Grace, sorry to pull you into this quickly, but in order to be eligible for grantees, all surveys collected, even if you can just do 5 or 6, that data contributes to our state level evaluation, and it's all really valuable and all really helpful to help us get an understanding of what programs have been impactful with the different populations and the different settings. But to receive a provider level evaluation report, we do need a certain number of surveys per program. And Grace, can you speak to the number of surveys that are required? Is it 10?
Yeah, can you hear me?
Yes.
Okay, great. It can be really challenging to detect change when the N is super small. I believe we were going for 25, Jesse. That's what I thought. 10, I think would be pretty low to be able to detect any sort of statistical significance. We can come to an agreement on that with TriWest, but I believe it was 25 last time.
I feel like my graduate professor, Dr. Alm, would want me to say anything less than 30 is not statistically significant. I have to say it.
Yeah, the 30 is it's out there. It's floating around as the standard. But yeah, the other thing I wanted to mention is just when you guys are sending in your surveys, if you could make it just really simple on yourself, which then makes it simple on me, just throw it in, the envelope, no staples or clips or like folding them up into envelopes and then putting those envelopes into a bigger envelope, which sometimes does happen. So just as simple as it can be for you is what's going to make it really simple for me.
Awesome. Thank you, Grace. Yeah. So again, even if you're only able to get 10 surveys, it's always worth mailing in or submitting the surveys that you're able to gather. But for us to be able to do provider level evaluation, the more surveys, the better. So we do have that minimum. It's like 25 or 30 per program in order to provide some provider level evaluation. And another big piece that is, if we only 10 surveys, it starts to get challenging to ensure like maintaining the anonymity of the survey participants and their responses as well. So yeah, if you guys have any concerns about, the number of surveys you're able to collect, feel free to reach out and we can talk through that. Okay, so really quickly, just wanted to go over the block grant timeline. The SFY2026 SUPTRS block grant award period started on July 1st. The quarter one activity report period for July 1 through September 30th. That quarter one activity report is currently open. The due date for that is October 10th. Then we enter quarter two, then quarter three, January through March, quarter four. And then the reimbursement request submission deadline is going to be June 15th, 2026. The end of the grant award period is going to be June 30th, 2026. And the deadline to mail in paper-based surveys for participant surveys will be July 15th, 2026. And surveys can be sent to ODP at any time throughout the year, but the deadline to submit them is July 15th or to get them in the mail to our office. And just some deadlines that always get confusing. The quarter four activity report, that deadline is July 10th. Then the reimbursement request deadline is June 15th. And then the survey mailing in deadline is July 15th. So just, don't get those confused. Same with surveys. Those reimbursement requests can be submitted at any point in time through between now and June 15th. Those quarterly are just submitted once every quarter, so once every 3 months. But just pay attention to those different deadlines for the grant activities. Okay, so just quickly wanted to go through some survey administration guidance, some tips and tricks to make sure that you are able to administer the surveys successfully and effectively, and that we are able to utilize the data for both our state and provider level evaluation. First, make sure to only use the SFY 2026 surveys provided by ODP and TriWest. ODP provides the surveys to grantees as PDF files. Do not alter or make changes to the survey documents. We have had grantees in the past try to change, say they're an organization that received funding to implement a program in 3 different schools, they would change the grantee name to these different schools instead of just keeping it as the provider. Just don't alter the header, don't alter the survey documents. If you feel like a survey needs to have any changes, let us know. We can work with TriWest, but they will be sent to you as a PDF file format, and you do not need to make any changes to the survey documents. Both the parent and older use surveys are 2 pages, but they're created to be printed as 1 page front and back. Please ensure that you print all the surveys on 1 piece of paper, so you will print them double-sided. When doing the printing settings, I suggest having it be double-sided with the flipping on the short edge, because that just makes it easier when you read it. If you print it on the long edge, then you have to flip it one direction, but it's up to you guys. And all of this guidance is also outlined and detailed in the survey implementation instructions that we'll be sending out after this call. So I know I'm going to go through this pretty quick, but yeah, printed double-sided. Surveys cannot be used if they are printed on 2 one-sided pieces of paper. It messes up. We can't connect the first page to the second page when we're doing the scanning of them. It messes up our ability to scan them easily and collect that data. So 1 page front and back. If you do not have the ability to print the surveys on 1 page front and back, please notify ODP and we can print surveys for you and mail them to you. Make sure that the surveys remain anonymous and the participants do not write their names on the surveys. All this data should be anonymous. We do not need their names. They do not need to put any identifying. We will ask them their grade, race, ethnicity, gender, some of that demographic information, but we do not need any identifying information to tie students to their surveys. If using a copier, we recommend making all copies from one original printout. So we often have grantees who print out one copy of the survey, and then they print out one copy, and then they'll make 60 copies from that one copy. Make sure that if that's how you go about it, that you do all of your copies from one printout. Don't print it, make 2 copies of that copy, and then use a copy of the original survey to make 10 more copies. The quality gets worse and worse the more you copy something. So don't make copies of copies. And then print all surveys on regular white copy paper, printer paper. Please don't use colored paper, as it causes the survey scanning software to misread responses and read responses as marked. Next, and a lot of this is referring to paper-based surveys, but program participants can complete the surveys, fill in the survey response bubbles using a dark colored ballpoint pen or pencil. We do not recommend using markers or felt tip pens, because these bleed through the paper and they can cause errors in reading responses on the opposite side. We also don't recommend using crayons, because these can jam the scanner, or highlighters, which can be too light to be recognized by scanning softwares. And grantees should avoid having program participants complete the surveys while eating, or immediately after arts and crafts projects, or on surfaces that might have food or liquids or other things on them that could get on the survey. Anything that sticks to the paper or can leave like oil stains on it can cause the survey to jam in the scanner or impact the ability of the software to read the survey responses. And this includes whiteout. If students if participants feel like they make a mistake, do not use whiteout to correct a response. If an error is made, respondents can cross out the incorrect response and mark their intended response. And we recommend that grantees track the delivery of surveys and packages to ODP to ensure successful delivery. So when you put something in the mail, you feel free to reach out to us and let us know, or feel free to reach out and say, hey, I sent these in. Did these get to you guys? But I think at the very least, keeping that tracking information, you can go online and check it and make sure that that package was successfully delivered. Okay, and I think that's all the tips and tricks. Again, there is more detailed guidance on survey administration and tips and tricks to make sure you do it successfully in those survey instructions that we will be sending out to you guys. But then also just wanted to open the floor for any grantee questions or discussion, or if anyone else has any thoughts on how you guys have implemented surveys in the past and some tips and tricks that have helped different grantees with survey administration. Yeah, if anyone has any questions.
Oh, I'm such a flibberty gibbet. I'm just going to ask another one, if you don't mind. In reading the parent survey, we administer parent surveys, but the framing of the questions sound like it's more for parents who are recipients of programming. So my assumption is we would not want to give any surveys to parents for child programming. Is that correct?
Yeah, you're correct. Sorry for that not being clear. Yeah, you only survey the direct participants that are receiving the programming. So when you do youth programming, Joey, you guys only survey the youth that are participating, those older youth. You don't need to survey the parents of youth participants. We have a number of grantees that do parent-focused programming, so like strengthening families, nurturing parenting, active parenting. When you're implementing a parent-focused or parent-specific direct service evidence-based program, that's when you would use the parent surveys.
Perfect. Thank you.
Hi, Jesse. This is Kate. We have permission slips for participation in our program, and do you think we could add consent to complete the surveys as part of our general release of liability and waiver?
Yeah, I think so. From my understanding, I think our grantees integrate the parental consent into their processes in a variety of ways. I know for a lot of our school-based partners, they have kind of a big parental kind of consent or parent sign-up process, or big parent kind kind of chunk of forms that they do at the very beginning of the year, and they've just kind of integrated this into their processes they already have. So I think if you guys already have a kind of a parental permission process, then if you want to just integrate kind of this survey consent piece into it, then I think that works great. We provide resources to help grantees, get understanding of the language or some forms to provide support with that parental consent. But it's really, it's our grantees. You have the ability to have that flexibility to mold the parental consent process and methods and formatting into the systems you already have in place. So, yeah. Great question. Okay. Any other questions? Cool. Let me see. I think Joey might have hopped off. Oh, wait, Joey, you're still there. I was going to ask, if you don't mind, Joey, I don't want to put you on the spot. So you did request a computer-based survey. Do you have any questions around, historically, we actually haven't, since COVID, we haven't had a grantee doing youth-focused program really utilize a computer or electronic-based survey. Do you have any questions or thoughts around how you will be sharing out that link, or anything you want to talk about?
Yeah, I mean, I know that we administer an annual youth survey that we give out. And so because we do that with a high volume of kids, and maybe this is me making an assumption at the sites, but we kind of have the groundwork laid for that, where it's, the kids are they know, like, oh yeah, we're going to do a parental consent process. And then once you have that and you store any file, we usually use passive consent. So it did raise a question for me with a school-based site, even though we're not a school program, we're not a publicly funded program. We're an optional care program that's outside of school hours, that if that would present some hurdles on passive consent, that tends to be the easiest for us because parents are largely accepting of that, but having them add another task to their day is often the thing that will get missed. And then, later the parent will be like, well, I was fine with that. And it's like, well, we needed you to get us that form, and you're tracking down forms instead of surveying kids. So passive has always been our go-to. So that was one thing, but even if the hard copy was used, we'd have to do that either way. So I'm just kind of chewing on that a little bit. But it's easy to send out an email through our membership management system to the parents for either consent. And then the computer labs just exist. So it's pretty easy to sit the kids down at the end of a program, and they're already trained to kind of know, oh, I log in here, I put on my headphones, I start the survey and do it. And then it gets done, and then it's all to you, instead of it being like, oh, let me talk to this site that printed it not two-sided, or all those things come into play, and getting them out to them. It's just easier to share a link that gets them to what they need. I am curious if the link would just be one link to a survey that if a respondent completes a survey, you can just reset and submit another survey response, or if it's like a unique identifier for each one. So I might be opening a can of worms to do that, and might be like, look, we're just going to print 100 of these things and get them to the sites and have them, available for them to do. So I don't know. I kind of feel like I'm going to have a conversation after this training with my team on the operations and really nail down what's the best process there, I guess. And I ideally would like to give them the option to say, hey, we can pursue the virtual route. And my guess, sorry, I'm dog sitting. My guess is that they're going to want virtual. So that's where I'm at.
Cool. Yeah, no, I think it makes a lot of sense why in those settings the computer-based would be easier, and just easier in the implementation and the management of it, making sure they're completed and returned. And from my understanding, and Cassie, Brittany, Lee, correct me if I'm wrong, it'll be one link that then will just be so all of the youth, like they can just share out the same link with all of the youth, right? It's not like individual links per.
That's right. Yeah, each program, just like we create a new PDF for the various programs, each program will have a unique link. So that's one thing to consider. If you are doing several programs, you'll need to make sure you offer the kiddo the right one after they receive that particular program. But then, like you said, Joey, then you can use that same link for, the kid sitting next to them who just went through that same program. So you won't have to have individual links per child, just individual links per program.
Okay. And then that also at times can be linked to an IP address on a computer. So, which should be, I think would be fine. But if let's say that we have a tech lab and we have, 8 computers and 16 kids participate in the program, 8 kids complete their survey, and then another, it's like a new set of 8 kids that were in the program sit down in the same seats. Would it say survey already completed, or you've already submitted a response for this? There are at times that is an issue, but I'm curious if I'm sorry to ask really technical, weird questions, and I'm not technology versed. Like I struggle with this stuff. So yeah.
That's a great question, Joey. I'm glad that you're raising it and thinking about those specific things. We use Qualtrics, and we will have a specific staff who knows all about Qualtrics, and they'll help us set it up and make sure that those issues aren't happening. And if those issues do happen, please let us know or let Jesse know, and we'll help you work through it. But I don't think there should be any issues with that. We can work out the IP tracking by either turning that off or having part of the instruction being opening a new browser. So yeah, those are great questions, and we'll make sure to provide that feedback when we offer the surveys. Anything you would add, Kathy and Lee, to that question?
I've worked in Qualtrics before, so I'm somewhat familiar with it. So, okay, perfect. Thank you.
I have one more question. As a program, similar to what Joey was saying, we're run by a nonprofit and we're an out-of-school program, but we are located on school district property. And so I'd be curious a little more information about the passive versus active parental consent and what we would need to do.
Yeah. No, great question. And I wanted to address that when Joey mentioned it as well. And, Grace, if you feel like I'm misstating any of this, feel free to jump in. But from my understanding, that legislation is directly focused at schools and school districts. If you are a non-school, if you're not a school or school district, but you're doing programming on school grounds, my understanding is that legislation would not apply to you. If you're a non-school organization doing out of school time programming, then you guys have the freedom to choose active and passive parental consent. If you already have a relationship with the school, it sounds like, Joey, you already kind of have a relationship with these schools. You've been doing kind of that passive parental consent. And Kate, I know you guys have been doing programming at up in the Sandpoint area, working with the school on those school grounds for a number of years. My assumption is that however you guys have been doing it previously, I would not see how this would be any different. You're more than welcome to bring it up to the schools if you think it would be helpful, if you think it's necessary. I will say, and I don't want to discourage anyone from bringing it up. If you have a good relationship with the schools, you could bring it up and say, hey, do you guys have a preference, since we're doing this on school grounds, for us to use active or passive parental consent? You can. Schools are very nervous about stuff. So I don't want to spook the schools, because I don't believe this legislation applies to them or to you guys just because you're doing programming on school grounds. So I think you are free to continue doing passive parental consent. You're not a school-based organization, you're not a school or school district, you're just an entity that's doing programming on school property. So I think that you're fine, but if you do have any significant concerns, you could always bring it up with the school partners and see if they have any thoughts or preferences. Awesome. Well, hopefully that was helpful. If you guys have any other questions that come up, you can reach out to Grace or I at ODP. Our contact information is up on the screen. And then you can also reach out to Lee with TriWest. And then I also know Cassie and Brittany, or Lee put Cassie and Brittany and her contact information in the chat. And when we send out a follow-up email, we will be sure to, all of the ODP and the TriWest staff will be included in that. So our contact information will be shared in that again as well. And we'll share a copy of this recording. Oh, thank you, Grace. Yeah, that's the code. We can also put a link to that code in the email so that you guys can read through it there as well. But we'll share out a copy of the recording, the slides, and all of the resources that we've talked about today. And then we will be sending separate individual emails to you guys later this week with copies of your specific program, grantee and program specific survey documents. And again, that link, we will share out that link if you want to request computer-based surveys to implement. So, yeah. Okay. If you have any questions, feel free to reach out. But then I think we can go ahead and wrap up. So thank you guys for joining. I appreciate the conversation.
Thank you, everyone.
Yeah.
Thanks, Jesse.